because I see this daily, and they need help, and they need help from someone who really looks into the root cause of the disease instead of, just giving them Tums or Prilosec.
There's an interesting partnership that can be had when you start looking at dentistry through this lens, because you're treating the manifestation in the mouth, and we can treat the root cause that might be happening in the gut. And so it's just kind of like perfect when you can work on both. Okay, hello everyone. This is Ryan Diener with Holistic Health Associates, and continuing our series of collaborating with medical professionals. And so if you are getting benefit from these videos, please remember to subscribe to the YouTube channel, like this video, share it, do all of those things so that it can help us continue to bring out this great content for you. All right, and now I am super excited. I have Dr. Mansi Oza with us today. Dr. Oza is the owner of a clinic named Thermont Smiles, which is a dentistry clinic that she has had in Thermont and has been practicing for 23 years. So we are super excited to have her to talk about dentistry, how it relates to health, how it relates to holistic health, how there are certain things that we both see in the treatment room. And I just couldn't be happier than to have you here with us, Dr. Oza. So thank you for being here.
Thank you, Ryan. This is a great opportunity. And like you said, together we can really help people move towards health. So I'm excited to be here.
Yeah, great. Me too. So why don't you start by just telling us a little bit about your dentistry practice in Thermont, and what, number one, what are some of the services that you offer in the dentistry practice? Because I know different dentists have different things that they offer. And then also, what makes your practice different than the average dentist that we might go to?
Yeah, sure. So giving you a little bit of a background, I grew up in India, and, we are big into Ayurveda. Whenever I fell sick, my mom always made some herbal teas and, herbal remedies, a lot of turmeric. So that's how I grew up. But then my family is half doctors. So then I was trained into traditional dentistry. I came here after being a dentist there, and I went to the prestigious Ivy League University of Pennsylvania. And I was still practicing, traditionally. But one thing that I continuously do is, continue to educate myself. And I have done that for 23 years now. And for past, I would say 5-6 years, as I was digging more and more, I can't get enough out of dentistry. So I was learning more and more. And, we were always taught about mouth and body connection. But when you really look into it, you see so many things inside the mouth, and from that you can diagnose what's going on inside the body. A lot of patients come to me. I'm a cosmetic dentist, so a lot of them come to me because they want to improve their smile. They don't love something about their smile. And I've been trained by some amazing cosmetic dentists, but the missing link, I would say, is that when we don't look inside beyond teeth, we really miss out on a lot of things. And I can give you world-class dentistry, and I do. But if there is inflammation in the mouth, or if your mouth is acidic, you are never going to retain the beautiful work that's placed in your mouth. It's going to fail. So I think the unique thing that we do is that we combine the holistic approach, make sure that everything is stable, inflammation free, you are healthy, and then your smile is beautiful.
Oh, fantastic. Well, I love the point of this relationship between the interior and the exterior. And so, and the reverse happens as well, right? If we don't feel confident about how we look on the exterior, sometimes that affects our mindset and affects the way that we think. And so it's very valuable to have these types of things. And one of the things that I think we get a little bit of a bad rap for sometimes in the holistic world is that we look at everything as the interior, everything is the interior. And the reality is, we want to feel good about ourselves as well. We want to feel like we are looking good, and that helps our interior perspective.
Yep.
The reverse, like to your point, is that, also, if you're only focused on the exterior, you're going to miss a lot of things that are happening on the interior that are slowly kind of chipping away at that beautiful exterior, that are kind of like rotting it out from the inside, not to be too graphic, right? But and one of those, so it's so important to keep both in the picture. And so I love that point that you're making about the inside and the outside, and this inflammation piece that we are all looking at, right? Everyone in medical is looking at inflammation, and it's interesting to hear that from a dentist. So speak a little bit more about how you notice inflammation, and what are the things that you do when you notice it.
So, most of the oral diseases are inflammatory in nature. So, one of the first things that we do when we see a new patient for the first time is that before we even give them a mouth rinse, which is the norm in our practice, we check the pH of their mouth. So, and unfortunately, I would say about 90% of our patients have acidic mouth pH. And yes, it can result from food. So if they just had coffee, then yeah, their pH is going to be acidic. But then we ask them to measure it over a period of 2 weeks. And if it stays acidic, it's going to ruin the teeth for sure. But then it also indicates that there is some gut dysbiosis happening, maybe some microbiome problem in the gut. And we must address that before I even drill and fill the teeth, right? Because otherwise it's all going to fail. So that is one thing. Second is periodontal disease is huge. If someone is leaving plaque or tartar on their teeth, it's going to cause a lot of irritation and inflammation in the gums. I always give this analogy to my patients that take a rock in your hand and rub it against your hand, and it's going to get wounded. And if you don't do anything about it, it's going to get really infected. And same thing happens in the mouth with tartar formation. Unfortunately, you don't feel anything until it's in the end stage. So it just continues. It causes all this inflammatory reaction in the body. And the blood, it brings all these fighter cells to the gums, and the infection drains inside the body. So that fight just continues on, and we don't know about that. So one can, I see a lot of us are trying to get healthy, but if your mouth is not healthy, you just absolutely cannot make your body healthy.
Yeah, it's interesting what you're pointing to. Two parallels that kind of come up from an acupuncture point of view as well, is that, you're talking a lot about the relationship to the gut and the relationship to digestive health, right? Acidic nature in the mouth being present in 90% of your patients, sign of gut dysbiosis, inflammation in the gums, or the periodontal disease. So interestingly enough, you don't hear dentists speak too often about digestive health, right? And you keep pointing back to the digestion being the key, which makes sense because what you eat goes through your mouth, and you're treating the mouth. And interestingly enough, the Chinese medicine relationship to the gut and the mouth is that every system, digestive system, the cardiovascular system, the respiratory system, they all have a body part that they open to, quote unquote, open to, meaning there's a relationship between that body part and the health of that body part and the system itself. And the digestive system, the body part is the mouth. And so there's a very close tie-in from what you're describing that you see, all the way down to what we do and how we're diagnosing it. And so there's an interesting partnership that can be had when you start looking at dentistry through this lens, because you're treating the manifestation in the mouth, and we can treat the root cause that might be happening in the gut. And so it's just kind of like perfect when you can work on both, you know. It's
Absolutely,
so perfect.
absolutely, absolutely. And I do need help for my patients because I see this daily, and they need help, and they need help from someone who really looks into the root cause of the disease instead of, just giving them Tums or Prilosec,
Yeah.
because that ruins the whole balance then.
Right. So say a little bit more about that, because so many people do go that direction. So they have some sort of digestive upset. They have maybe some acid reflux coming up, some discomfort coming up through the chest, pain after they eat, some sort of abdominal discomfort after eating. And the most common thing that we see is people take Tums, or they take Prilosec, or they take Nexium. Tums is over the counter. Prilosec, Nexium are things that are prescribed to you by a GI doctor or potentially your primary care physician to help calm the acid down in your gut. They're called proton, or it's a proton pump inhibitor, PPI, right? You said that changes the balance of what's happening. Can you speak a little bit more about that?
Yeah, sure. So, you're basically preventing the hydrogen ions. And obviously, I have to stay in the mouth, but to understand it a little bit better, if we stop the production of acid, which is not the cause of the acidity, right, or acid reflux, the problem is in the sphincter, meaning that where the esophagus and the stomach connect, there is a valve that has to be tight. So the problem is in the valve, because we do need that acidic pH to digest food properly, to kill all the germs that we are digesting from the mouth. So we don't want to stop the acid production, which is how the body is so well designed. So we don't want to stop something that nature created. We just need to make sure that that sphincter, or the valve between the esophagus and the stomach, is working properly. If it is tightly closed, the acid cannot ride up. Because if we stop the acid, then all those ions will go in the body, and now the whole body will become acidic. And when we look inside the mouth, we take a glimpse of it. We see the tongue that is white, it's covered, even if someone is using a tongue scraper, and that suggests the dysbiosis that's happening in the gut.
Yeah, it's interesting that you talk about the tongue. So the tongue is a diagnostic that we use as acupuncturists. We look at tongues every day. And one of the things that we also see is this thickening of the tongue coating. And the more thickened the tongue coating is, the more the body is holding on to things that it doesn't need, right? So our goal is to see a tongue that has a thin coating, moist, fluid is moving through it regularly. But when the gut is out of balance, when your digestive system is out of balance, whether it's either too acidic or too basic, not acidic enough to break down the food, then you have the body holding on to things because it's not properly breaking down your food. It's not properly separating out the nutrients that your body needs from the waste. And so your body becomes a little bit of a swamp. And so the thickening of the tongue coating is a sign of the body literally becoming a little more swamp-like, and so one of the things that we recommend is, obviously food related. One of the things we recommend is supplement related. We recommend a detox program a few times per year. And then
I did that one.
Yes, and you have
Loved it.
Yeah. So you know exactly kind of what we do in regards to that. And then when it manifests in the mouth and you actually have inflammation in your gums, one of the things that we note as Chinese medicine practitioners is that has to be addressed, because when you have inflammation or disease in the gums or in the mouth, it can easily transfer into the digestive system. There is this relationship that people don't really talk about very much, where the external issue can actually penetrate into the internal issue. So then you could have all of these things going great. You've changed your diet, you're taking supplements, but you still have inflammation or periodontal disease. That's also going to be a problem, because it can seep in through your gums, through your body tissues, and it can enter into the areas that it can cause problems. And so it's almost like you have to do both. You have to be able to deal with the periodontal issue and the gum issue and the teeth, and you have to do some of the interior work. Does that make sense?
Yep, that's absolutely right. And periodontal disease is huge. Alzheimer's, diabetes, high blood pressure, high cholesterol. Now they are finding, they always knew that there was a link between it. Now they are finding that periodontal or the gum disease can actually cause these diseases, or COVID-related complications like hospitalizations or ventilator use or death are 3 times higher with someone who has periodontal disease. So it's huge. It's a big inflammatory condition in the body.
Yeah, for sure. And it's interesting because in the holistic world, we've talked about this for millennia, centuries, where you say the interior affects the exterior, but the exterior also affects the interior. And in allopathic medicine, we often keep it very separate. These are 2 separate processes. They need to be addressed by separate people, separate things. And one of the things that is so fantastic about what you're describing is you're actually talking about holistic dentistry. I mean, it's really, it's actually a beautiful thing to hear. And it's like, it's fantastic to have someone in the dentistry world that is looking at the teeth, at the gums, at the periodontal disease, but is also recognizing that there is this kind of deeper root issue. And so that is, so thank you for that work. That is really fantastic.
Thank you. Thank you. And it's very interesting. And, the goal should be for every healthcare provider is to help heal the patients. And like we discussed before, we all have to work together to help people move towards health.
Yeah, for sure. For sure. So tell us a little bit lastly about just the practice itself. So tell me, obviously you do routine cleanings, it sounds like you're working on gum disease and periodontal disease. What are some of the other things that you recommend? Oh, and you mentioned cosmetic dentistry as well. So can you just give us kind of an overview of the primary services that you offer in your practice?
Yeah, sure. So we take pride into being, cutting edge with our technology. So we have CEREC CAD/CAM technology. We have dental laser. So we are, and I'm really like OCD about how things are done in my practice. So, when we invested into the CAD/CAM dentistry, now we are able to design the porcelain restorations right in front of you. And we have the milling capability right there in the office. So one crown used to take at least 2 or 3 appointments 1 month apart with temporary crowns and all that inflammation going on around the temporary crowns. Now we are able to do it in just 1 single visit. Wow. So that is something that I really enjoy doing, and I'm able to match the shade to your teeth. So, it feels like your natural tooth. I'm able to design the forces properly, so your tooth doesn't break in future. So that is one of the things that we do. We do laser dentistry. So if someone has any gum problems or any soft tissue issues, we address that too. Anything like Invisalign with teeth movement, we are able to provide that. I take pride in being a biomimetic dentist, meaning that less is more. I don't want to cut down the tooth structure unnecessarily. So we mimic the nature, and with the help of technology, we are able to do that too. I place dental implants, and we provide mercury removal treatment because heavy metals is another way which the body doesn't like, right? So it causes inflammation and all this issues in the body, neurological issues. So I'm SMART certified to remove the mercury safely. So yeah, we do a lot of things.
Yeah, fantastic. That is wonderful, wonderful, wonderful. And the practice is Thermont Smiles. It's in Thermont. You are And the website is thermontsmiles.com, correct?
That's right. Yeah. And I'm pretty active on social media also. I'm continuously sharing tips, obviously, to make a positive difference in someone's life. And it's Instagram and Facebook, Thermont Smiles.
Beautiful, beautiful. Well, thank you so much for being here. This has been really, really fun. I feel like, you know, as I've said to a lot of the people that we've done interviews with, I feel like we could talk for hours about this, you know,
That's right. I
especially.
felt the same way.
Oh my gosh, you know, so we'll have to do it again for sure. And we'll pick some different,
Absolutely.
you know, we'll pick different topics each time, but the relationship between the gut and the mouth is so important in both of our fields. And it's so great to talk about and just look at this digestive, you know, and since we have a subspecialty, you know, different practitioners in our office have different subspecialties, and mine is GI and autoimmune conditions. And so it's just, you know, I know we have so much more to uncover with this. And
We do.
oh yeah, oh yeah, it's been.
Absolutely. And I appreciate the opportunity. I had fun time chatting with you, and we'll definitely do it again.
Yeah, definitely. Okay, thank you, everybody. And if you can, you know, if you like the content, please, or even if you didn't, like the post anyway, like the video, share it, and make sure you subscribe to the channel. Thank you so much for being here. Thank you, Dr. Oza, and we will be with you all soon. Take care.
Take care.